All right, welcome to another deep dive. This time we're going exploring community health nursing in Canada.
Ooh, interesting.
Yeah, and get this, we've got two really cool sources to help us out.
Okay, lay it on me.
First, we have Stanhope and Lancaster's Community Health Nursing in Canada, you know, the textbook.
Ah, classic.
And then we have Let's Talk, Moving Upstream, which is like a paper, but it's a really thought-provoking one.
I see. So we're getting right into the nitty-gritty.
Exactly. Now, you listening out there, you're probably interested in this field, and well, let me tell ya, I'm excited to learn more too. And luckily, we have an expert here to guide us.
Happy to be here.
So one thing that really jumped out at me from Stanhope and Lancaster's was this stat. Almost 16% of nurses in Canada are community health nurses.
Wow, that's a significant number.
Right. It really highlights how important this field is becoming. And you know what else? It's not just about treating people when they're sick.
Absolutely. It's about understanding that health is so much more than just the physical body.
So true.
It's about recognizing the impact of things like where someone lives, what kind of job they have, even the environment around them.
Right, the whole picture.
Exactly. And community health nurses really take that big picture approach. They try to stop those things from becoming health problems in the first place.
I love that. It's like they're being proactive, not just reactive.
Yes. And in Stanhope and Lancaster's, they call it the determinants of health. And that brings us to the whole upstream analogy, right?
Ah, yes, the upstream approach. I was going to ask you about that.
Okay, so imagine a river, right?
Okay, got it.
Traditional healthcare is all about rescuing people who have fallen in, like treating the illness.
Right.
But community health nurses, they want to know why people are falling in to begin with. They want to address those upstream factors to prevent it from happening.
I get it. So instead of just putting a bandage on the problem, they're trying to, build a fence upstream so people don't fall in the river.
That's a great way to put it.
Or maybe even redirect the river altogether.
Exactly. And let's talk. Moving upstream really dives into those different levels of intervention, the upstream, the midstream, and the downstream.
I'm guessing downstream is what we usually think of as healthcare, like going to the doctor's office or the hospital.
Yeah, exactly. That's where the focus is on treating the problem after it's already happened.
So what about upstream and midstream? What would those interventions look like?
So imagine upstream as tackling those root causes of health problems,
Okay.
like advocating for policies that make housing more affordable. Because we know, right, that homelessness leads to all kinds of health issues.
That makes a lot of sense. And then midstream would be?
Midstream might be something like starting a community garden in a neighborhood where it's hard to get fresh, healthy food.
Ah, okay. It's like providing the resources people need to make healthy choices.
Exactly. It's about creating environments that support health and well-being.
This is fascinating. And the textbook, it actually lists 14 social determinants of health.
14.
Yeah. It's income, education, early childhood development, food security, housing, and it goes on and on. It really makes you think about how many different things impact our health.
Right,
So
absolutely.
yeah.
And the thing is, all those things are connected. They don't exist in isolation,
Right. So you can't just address one thing and expect everything to be fine.
Exactly. Let's take food security, for example.
Yeah, okay.
If someone can't afford healthy food, it obviously affects their nutrition,
Mm-hmm.
but it's also tied to their income and maybe where they live.
Like if they live in a neighborhood without a grocery store or...
Right, or if they work multiple jobs and don't have time to cook.
Wow, it's like a tangled web almost.
Yeah, it is. And that's what makes community health nursing so complex.
Yeah.
And so crucial.
So it's not just about knowing the medical stuff, it's about understanding all these interconnected factors.
Absolutely. It's about seeing the whole person and the whole community.
It really is amazing when you think about it. Community health nurses really do have their work cut out for them.
They do, and it's not always easy.
Yeah, I can imagine there are so many different factors to consider, so many challenges to navigate.
Exactly. And one of the biggest challenges is figuring out, well, how to balance individual rights with the needs of the community.
Ooh, that's a tricky one.
It really is. Like how far can you go to protect public health if it means infringing on someone's personal choices?
Yeah, that makes me think of that example in the textbook about the community health nurse working with the patient who had tuberculosis.
Oh, right, the one who didn't want to go to the hospital.
Yeah, exactly. They were worried about spreading the infection, but the patient was really resistant to being hospitalized.
That's a classic example of the ethical dilemmas community health nurses face.
It's like, how do you balance respecting someone's autonomy with protecting everyone else?
That's a tough call.
Yeah,
And there's no easy answer. It requires a lot of sensitivity, a lot of clear communication, and a deep understanding of the community you're working with.
definitely. And speaking of understanding the community, the textbook talks about something called capacity building.
Yes, capacity building is so important.
But what does it actually mean in practice?
Well, it's all about empowering people to take control of their own health.
Okay, so not just telling them what to do, but helping them figure it out for themselves.
Exactly. It's about helping communities identify their own needs, their own strengths, and then giving them the support they need to make positive changes.
So it's like instead of swooping in with all the answers, you're working alongside the community to find solutions that are actually sustainable.
Exactly. You hit the nail on the head. It's about creating lasting change that comes from within.
I like that. And are there specific examples of how community health nurses do that?
Tons. For example, a community health nurse might work with residents to advocate for a new park in their neighborhood.
Because having access to green space can improve people's mental and physical health, right?
Exactly. Or they might help set up a community garden in an area where it's hard to find fresh produce.
So it's about addressing those social determinants of health that we were talking about earlier.
It all ties together, doesn't it?
Oh, it really does. It's all connected. So we've got this holistic approach, a focus on prevention, ethical considerations, capacity building. It seems like community health nurses wear a lot of different hats.
Oh, they definitely do. The variety of roles they can take on is pretty amazing.
Yeah, the textbook lists a bunch of them, right? Like public health nurses, home health nurses, occupational health nurses.
Yep, and don't forget about street nurses.
Oh, right, the ones who work with people experiencing homelessness. That's such an important role.
Absolutely. They're out there on the front lines, providing care in really challenging situations, building trust with people who might not feel comfortable going to a traditional healthcare setting.
It must take a lot of compassion and skill to do that kind of work.
It does. And street nurses do incredible things. They provide wound care, connect people with shelters and other social services, and they even advocate for policy changes to address the root causes of homelessness.
Wow, they really are making a difference. So with all these different roles and all these complex issues, I'm guessing collaboration is key, right?
Oh, absolutely. Community health nurses can't do it alone. They work with doctors, social workers, community leaders, all kinds of people to create a network of support for individuals and communities.
That makes a lot of sense. And are there any specific examples of that kind of collaboration in action?
Sure. One great example is the Canadian Collaborative Mental Health Initiative.
Okay, tell me more about that.
Well, it brings together all sorts of healthcare professionals to provide more comprehensive mental health care. They recognize that mental health is influenced by so many factors, not just what's going on inside someone's head.
Right, it's about their social environment, their economic situation, their physical health.
Exactly. It's about the whole person. And this initiative helps break down those silos between different healthcare providers so they can work together more effectively.
That sounds like a huge step in the right direction. And it's interesting because I was looking at that YouTube video transcript we have, and it talks about how the Canadian Community Health Nursing Standards of Practice have actually been updated to include roles in public health, home health, and primary care settings.
Oh, that's right. I forgot about that.
It seems like there's a growing recognition that community health nurses have a really unique perspective to offer.
Definitely. They can see those connections between different parts of the healthcare system and help people navigate those systems more effectively.
Yeah, it's like they're acting as bridges, making sure people get the support they need on all those different levels.
Exactly. And I think it speaks to a broader movement towards a more integrated and holistic approach to healthcare in Canada.
Which is a really exciting thing to see. Wow, community health nursing really is changing the way we think about health and healthcare.
Really is.
It's like it pushes those boundaries of traditional nursing and makes us think outside of just the individual person.
Yeah. It makes you look at, like, the systems and structures that actually affect people's health.
It's pretty amazing stuff. So we've covered a lot of ground in this deep dive.
We have.
We talked about how health is about way more than just our physical bodies and how those social determinants like income and education and housing can have a huge impact. We talked about all the different ways community health nurses work upstream to try and prevent health problems before they even happen.
Right.
And how they help communities take charge of their own well-being.
Yeah.
And then we saw how all these different roles are evolving to meet the needs of our healthcare system, which, are always changing.
Absolutely. Always evolving.
So what does this all mean for you listening out there? What's the big takeaway from all of this?
Well, I think the most important thing to remember is that health is really complex.
Yeah.
It's not as simple as just making good choices.
Right.
It's also about the environment you're living in, the resources you have access to, even just the opportunities that are available to you.
It's kind of like that saying, it takes a village,
Yeah,
right?
exactly.
But in this case, it takes, well, the whole community and like a whole team of dedicated people to work together to actually make a healthier society.
You got it.
Yeah.
And community health nurses are like the backbone of that team.
This has been such an eye-opening deep dive. Thank you so much for sharing all your knowledge and insights with us.
Oh, thanks for having me. I enjoyed it.
And to everyone listening, I hope this has helped you understand a bit more about the awesome work community health nurses do here in Canada.
It's pretty amazing.
If you want to learn more, you should definitely check out the sources we talked about, Stanhope and Lancaster's Community Health Nursing in Canada, and Let's Talk, Moving Upstream. They're full of, well, fascinating info and inspiring stories. So keep learning, keep exploring, and keep asking those upstream questions.
Yeah, those upstream questions are key.
The more we understand all the things that affect our health, the better we can make the world a healthier place for everyone.
Absolutely.
Until next time, happy diving.